Welcome to Eye on NIH. In this month's episode, a special interview with an award-winning NIH scientist, an in-depth report on deep brain stimulation, and an eye-to-eye interview that looks at stress. From the National Institutes of Health in Bethesda, Maryland, America's premier medical research agency, this is Eye on NIH, covering health research topics important to you and the nation. This public service vodcast is your information source from inside all 27 institutes and centers at NIH. Half an hour, once a month. We'll show you the excitement of advances and the important information that comes from medical research. And now, here's your host, Joe Belinfy.
Welcome to another episode of Eye on NIH. Now, in this next feature, we're taking a close look at deep brain stimulation, or DBS. This treatment is very close to home for one of our coworkers, Bill Schmalfeld. Bill has Parkinson's disease and earlier this year joined a clinical trial at Vanderbilt University Medical Center in Nashville to test how well DBS may work as a treatment for patients in the early stages of the disease. Bill let us turn the cameras on him along with Dr. Joseph Pancrazio, a researcher with the National Institute of Neurological Disorders and Stroke. We started by discussing what exactly is Parkinson's disease.
Well, that's a disorder that belongs to a class of disorders that we would call basically motor dysfunctions. And this is a disorder that affects a region of the brain called the basal ganglia. It's a region that has a lot to do with the control of movement. Several years ago, the option was to remove the section of the brain that was responsible for the aberrant activity. So we're talking about rather severe and irreversible. These are irreversible procedures. They're called thalamectomies, where regions would be removed. And now and the other options involve medical treatment, where you're replacing the lost neurotransmitter, that part of brain signaling that has been suppressed or lost during the progression of Parkinson's disease. Now, the option here with deep brain stimulation is really exciting to us, because now we're talking about not just treating cells and molecules, we're talking about treating actual networks of activity. We're talking about treating the aberrant conduction of activity in the brain to relieve the symptoms.
Often promoting the importance of medical research through the NIH Radio News Service and NIH Research Radio podcast, Bill made the decision to volunteer for a clinical trial and was selected for the surgical treatment, DBS, which is major brain surgery.
The surgery is done in 3 separate phases. I went down on June 5th and had these little, if you can see them here, these little gold portions of the screws implanted into my scalp. These little 4 things here, and I've included a picture. I guess you can look at those. And then when they did the MRIs and the CAT scans, so they could use that for the plotting of the approaches they were going to take for the actual surgical procedure. This is the platform that they use to hold the drivers for the probes that move a micromillimeter at a time into the parts that they want to test and then stimulate. And I think I've included a picture that I call Bill Schmalfeld in the Matrix. It just looks like that scene from the Matrix where Neo is hooked in. That's what this thing looks like more than anything else. So it increases the comfort level of the surgery. It decreases the time actually spent on the table. And then for the third phase, you go in my case, it was like almost 3 weeks later, to have the neurostimulators put in.
Bill and Dr. Pancrazio explain that Phase 2 is by far the most technically challenging.
Well, it'd be basically like taking you can imagine taking the antenna of a car antenna and trying to shove it into a pea. So you're
through a melon.
And so you've got a large sphere that you're trying to maneuver that through and trying to target that extremely small location. So having very precise alignment features that are available within these kinds of stereotactic frames, doing all that terrific imaging work, because none of this would work unless we knew where in the brain to actually go after. It's been enabled by studies like PET studies, positron emission tomography studies that tell us where the metabolic activity is associated with controlled movement is located. MRI studies allow us to look at very, very small, with some levels of precision, these regions of interest in the brain. So all this imaging data and imaging technology has been absolutely critical in the development and implementation of deep brain stimulation.
This is the frame they used on me. You've seen pictures of those huge stereotactic frames that they actually have to bolt your head into place and leave you actually clamped to the table. Now, at Vanderbilt, they've pioneered the use of this thing. It's individually made for the patient.
So the progression towards these kinds of frameless surgeries is something that's going to make the entire process far less painful.
The worst thing about the whole surgery was having the injection of the skin numbing medication. The doctor and Dr. Peter E. Conrad at Vanderbilt University said this is going to feel like giant hornets stinging, and he was not far off. Other than that, because the brain is insensate, mine more so than others, it was really not that much pain or discomfort involved.
Joking and modesty aside, signing up for a clinical trial and basically volunteering for brain surgery is commendable, says Dr. Pancrazio.
I think that one of the common features for many of the patients who are participating in clinical trials like this, as well as undertaking DBS as an option, is they're still pioneers. This is an area, and this is something we spoke about a little while ago, that this isn't a pill you're taking necessarily. This is a commitment to us, in a sense, to have something implanted within your brain and to receive electrical stimulation as a means of delivery of therapeutics. Now, the good news is it's very targeted. You know, this is a very small, relatively small region, a very busy region, obviously, because there's lots of potential side effects if you don't get the stimulation right. But it really is something that's very new. It's something that, you know, our society has a lot of questions about. You know, what does it mean for us? And it's something that I think that every patient who's participating in a trial like this is a pioneer.
Yeah. Bill, however, keeps perspective on this treatment.
And the nice thing about it is, if they find a cure for Parkinson's tomorrow, they just outcome the wires, apply the cure. Right. It's absolutely reversible.
Right. And that's a common feature of many of our neural interfaces, or the technologies that we're using to treat disease, is that many of them can be replaced or removed immediately if the cure becomes available to a patient.
For more information on deep brain stimulation, visit www.ninds.nih.gov. And for information on clinical trials, visit www.clinicaltrials.gov. And be sure to tune in to Bill's NIH Research Radio podcasts at www.nih.gov/news.